Hello, Dr. Cisse covering anatomy and physiology. Today, I'll talk about blood. Blood is a connective tissue. It's a liquid connective tissue. It is made of ground substance, fibers, and cells. The ground substance of blood is plasma, and all the cells are called formed elements. If you look at the blood cells here, they're divided into groups. Of course, we have red blood cells here called erythrocytes and white blood cells called leukocytes. So the red blood cells do not have nuclei. The nucleus is lost in the red blood cells. That's why they look like donuts. So the middle part is kind of dented in the middle a little bit. The white blood cells are divided into two groups. The ones that we can see the granules clearly are called granulocytes, and the ones we cannot see the granules clearly are called agranulocytes. There are three granulocytes. The way to memorize them is N-E-B. N stands for neutrophil. Look at that. This is a neutrophil, neutrophil, neutrophil. You can see that the nucleus looks like an old pillow, neck pillow. But the neck pillow got older and it's broken into pieces. Usually you're gonna see about 3 or 4 or 5 pieces in the neutrophil. For example, you see 3 pieces here, 3 here, 1, 2, 3, 4, 5, 1, 2, 3. So the neutrophil, old neck pillow into pieces. N. E, eosinophil. The way to memorize eosinophil, look at that, it's like number 8. You see it like bented number 8. But when it gets older, it became also in pieces. The nucleus kind of broke down into pieces also. But you can see that the granules are kind of more in a different color. It's like a neck pillow on the eosinophil. Here also looks like a neck pillow, but we call it number 8 here. And then you can see eosinophil. The third one is the basophil. This one, usually you see that the nucleus is kind of broken into pieces, the basophil. Then the 2 agranulocytes are lymphocyte and monocyte. The lymphocyte, the way to recognize it, the nucleus kind of fill into the whole cell. The whole cell is filled with the nucleus. It's different than the agranulocyte where the nucleus doesn't take a lot of space. That's the lymphocyte. And then the monocytes, the way to recognize it, the nucleus looks like a kidney bean. Here it's dented a little bit, kind of shallow a little bit, right here. And here it's even more dented here, the monocytes. So the monocytes look like kidney beans. The lymphocytes, the nucleus fill in the cell. It takes more space in the cell. And the 3 granulocytes are neutrophil, usually have more neutrophil in the blood. Most of the white blood cells are neutrophil. And then eosinophil, like I think number 8 here, more older one will be broken neck, broken pillow here, just like neutrophil. But the eosinophil, the nucleus will be broken in pieces, but the cell is going to be a little bit in different color. Then, of course, the basophil, I think about like basic color, is like a basic shape. The nucleus will be like usually 2 pieces in there. And then, of course, the red blood cells are easy to recognize. Again, red blood cells and white blood cells, leukocytes. 5 of them, NEB, neutrophil, eosinophil, basophil, and then LM, lymphocytes, and monocytes. And then all the little pieces are called platelets. They are broken pieces of cells inside blood. This is the different cells of blood, and I'll see you in class. Thank you for watching.